If you're not on Medicare, go ahead and skip this video. This one's not for you. Welcome back. Thank you so much, folks, for being with me here today. Very excited to talk about one of my favorite subjects, which is Medicare. What is Medicare? Are you on Medicare? Are you turning 65 soon? Have you been on Social Security disability for 24 months? Do you have end-stage renal disease or permanent kidney failure? Hi, my name is Philippe Lundstick here with ProCare Consulting. So excited to have you here today to talk about my favorite subject, which is Medicare. So what is Medicare? Let's start there. Medicare is a federal program that has been designed for senior citizens, people turning 65, also people that were on Social Security disability income for 24 months or longer are entitled to Medicare, or if you have end-stage renal disease, which is permanent kidney failure. There are different parts of Medicare. Let's talk about the first part. Medicare Part A, that's the first part of Medicare. What is Medicare Part A? Medicare Part A you automatically get as long as you've worked 10 years here in the United States or 40 quarters. If you haven't worked 10 years or 40 quarters and you want to get onto Part A, there will be a premium associated with that. But know that most Americans get Part A at absolutely no cost to them. And what does Part A cover? It basically covers all the hospital administration side of things, okay? If you go to the hospital, it pays for your room and board. Think about it like that. That's what Part A pays for. What is Part B? The second part of Medicare is Part B. So first we have Part A, which covers the hospitalization. The second part is going to be Part B. And that part is going to cover your doctors, your physicians, your surgeons, your surgery, all those important things that happen to you while you're in the hospital. Now, does Part B cover everything? It definitely does not. It only covers 80% of your health care, which leaves you with a co-insurance or a cost share of 20%. Now, please understand that 20% is very relative. 20% is relative to the value, and that value could be $100,000. Have you ever heard of that? Someone going in for surgery in the hospital and it costing hundreds of thousands of dollars? Now, imagine if you had to pay 20% of that cost. That could be detrimental to your bank account and your personal economy. What else is associated with Medicare Part B? Medicare Part B, you do have to pay for. There is a premium associated with Medicare Part B, and this year that premium is going to be $148.50. Please understand that those premiums, they go up sometimes every year, but eventually they do go up. If your premium goes up, you will be notified by Medicare somewhere around the time of Christmas. You'll find out when those rates are going up. So let's talk about the next part. We talked about Part A being for the hospitalization. We talked about Part B, which is really for the doctors. It pays at 80%, which leaves you with a 20% coinsurance. There's another part to Medicare as well, and it's called Part C. Medicare Part C, I always like to think about as like Medicare Complete. What Medicare Part C represents are Medicare Advantage programs like HMOs and PPOs. There are a lot of different costs associated, so many different kinds of co-insurances, what your co-pays are, what your deductibles are. There are hundreds of plans available to you. That's what we're here for. We're here to help guide you through those processes. But please know that Part C is Medicare Advantage. The last part of Medicare is known as Medicare Part D, D as in dog. And what that represents is the prescription drug side of Medicare. You see, in 2006, the government got together and decided, hey, we need to come up with a better system for prescription drugs. We want to make sure that all the seniors are getting the right services that they need in order to get their medications. So know that the government has set a basic blueprint in which all insurance companies must follow. And that basic blueprint is what we know as Medicare Part D. And Medicare Part D has a few different structures within inside of it. There's a deductible stage, an initial coverage stage, a coverage gap stage, or known as the donut hole, and then the catastrophic stage. Please look out for other videos about Part D that will explain in great detail the different options that you have if you're looking for a prescription drug plan. So great, guys. That's the foundation of Medicare. It's important to understand that Part A is something that you're entitled to as long as you put in your 40 quarters or 10 years of work here in the United States. Part B is for the doctors, and that's only going to cover 80%, which leaves you with a 20% coinsurance. And that Part B will cost you $148.50. And remember, that doesn't come out of your pocket. That comes out of your Social Security check behind the scenes before you even get the check. The third part is Medicare Part C, that's the Medicare Advantage program. The fourth part is Medicare Part D, which is the drug program, which are individual plans or plans that can be wrapped up into a Medicare Advantage plan. And that's the foundation of Medicare. Remember, here at ProCare, we truly believe that education is the foundation of all good relationships. And we want to make sure that you understand the foundation of what all these programs are built on. So that's Medicare and a simple and easy way to go through. Please keep an eye out. We do a lot of virtual Medicare 101s where we dive into this subject in great detail to make sure that you know all the secret ins and outs about Medicare. So now that we understand the foundation of Medicare, what's our next steps? Our next steps is going to be following those 3 pillars that we talked about earlier. Now it's the time, if we understand what Medicare is, we look for the right person to represent us, right? You pick the right broker. You look for the right company that you want to do business, right? Picking the right company. And last, you look for the right plan, the one that caters to you best. That's what we're here for at ProCare. Let us help guide you through this process. So please know that we are standing by, waiting for you. Guys, again, thank you so much for joining me here today, folks. Please make sure you subscribe to the channel, like the video, and please leave us a comment. We'd love to hear from you. Now, don't go yet. We've got exciting news. The next video that we're going to cover is going to break down 2 things that are really important, and those are your options once you're on Medicare. Medicare supplements versus Medicare Advantages. Guys, thanks so much, folks. I'll see you in the next video.